Welcome back to ABC-7 at 4. I'm Mark Ross. Tomorrow is World AIDS Day, and the theme this year is Let Communities Lead, a call to action for cities and towns across the U.S. to enable and support in the fight to end AIDS. ABC-7's medical contributor, Dr. Ogechika Alozie with Sunset West Health, who is an infectious disease doctor, is here to talk about the progress being made in the fight and will explain his U equals U t-shirt in just a couple of minutes.
Absolutely.
Doctor, 33 years, there's been quite a bit of progress made to understand and most importantly, help people who are living with AIDS live a normal life, but it's important now to recognize the difference between HIV and AIDS.
Yeah, and so I think it may seem like a technical point, but it's important to understand that HIV, or human immunodeficiency virus, is the virus. That's what people get infected with. Now, the HIV affects a certain type of cell in the body called the CD4 cell. It's your immunity cell. It's what protects you against a lot of different things. As your CD4 number gets lower and lower over years, and it could take 5 years to 10 years, you actually then have a condition or a state called AIDS, which is the actual autoimmune, acquired immune deficiency syndrome.
Now, even with all the progress that's been made, people with AIDS are still dying.
Yeah, so I think this is a good news, bad news slide, right? The tragedy is that there's still almost 700,000 people dying. But if you look almost a generation ago, in the 2000s, early 2000s, it was 1.7 million. We've made immense progress. The real question then becomes, well, what has happened that we've made that progress?
So there's a treatment that's helping people with AIDS live longer.
Yep, and I'll talk about that specifically, but I think one of the things that's really been amazing that the United States has done is initiate what's called PEPFAR, which is the United States President's Emergency Plan for AIDS Relief. And if you look at that, over an 18-year span, they've increased the number of persons on these life-saving therapies by 300 times. And because they're on these life-saving therapies, we've actually increased the percentage of people that don't have a viral load, and that's really important. I'll explain that when we get to the U equals U piece over the last few years, and that's critically important.
Yeah, let's see those viral suppression rates.
Yeah, and exactly. We've gone from 80% in 2015 to almost 95% in 2022, and I'll talk about why that's important.
So talk about those key actions that are helping to end the HIV epidemic.
Yeah, so there's a concept called status neutral, and this really talks about it. It's not just the right side, which is when you contract or if you get HIV, come to an organization like my own, we'll get you treated. The target is 95%, we're only at 63, so we still have a ways to go. There's the testing across the city, multiple organizations do the testing. I think it's just as important to prevent it. And there's a medication, it's called pre-exposure prophylaxis, which can actually reduce the risk of contracting HIV by 90%. You can also see we have a ways to go to get where we want.
Now explain what antiretroviral therapy does. Boy, that was a mouthful.
Yeah, it is a mouthful. And so once upon a time, it was called the cocktail. It was 12 to 18 drugs that you took 4 to 6 times a day. That's way behind us. Now, the average person living with HIV takes 1 pill a day. It works at a 98 to 99% rate if they take the medication. And why that's important is that when they take that medication, it gets their viral load down and they're undetectable. So that's the magic of my shirt, right?
Yes, U equals U.
Yeah, and so U equals U. Undetectable equals untransmissible. And the data clearly shows that if you take your medication, your viral load's undetectable, you can't transmit the virus, and that's the key to breaking and ending this epidemic.
And finally, let's look at all of the local resources that are available here, including Sunset West Health.
Yeah, and I would start with us. HOPWA is a housing opportunity for persons with AIDS. A bunch of organizations have it. The health department does an amazing job. The Purple Page is an online resource for persons that are concerned about that. Obviously, M-Factor, my organization as well, is one of the biggest alongside LaFay in treating, and we're going to talk about a LaFay event tomorrow.
That's right, and coming up tomorrow from 11 a.m. to 3 p.m., on Mescalero Street, it is the World AIDS Day event that's being hosted by LaFay's Care Center. There will be HIV rapid testing available, health screenings, insurance information, and more. And I guess to wrap it all up, the stigma, is the stigma still there after all these years?
The stigma is still there, and it comes back to what we've talked about before, that sort of health literacy, right? People don't have the details about HIV, and I don't expect them to. But I think what's really important is that HIV is no longer a death sentence. HIV still exists. Be careful with sex, condoms, pre-exposure prophylaxis. Again, I think I like to end with hope. There's hope. We're getting better. There's injectables that are there so you can prevent contracting HIV. And if you get it, take one shot every 2 to 3 months. A year from now, it'll be even different. And we're going to lead the way in hoping to get some of these therapies into our region.
ABC-7's medical contributor, Dr. Ogechika Alozie. Thank you, sir.
Thank you, sir.